Everyone, this is Dr. Prachi Goel from Dr. Goel's Clinic, Senior Homeopathic Consultant and Diet Counselor. And today we will discuss about thyroid ailments. There are two types of thyroid ailments, hypothyroidism and hyperthyroidism. हाइपोथायरॉयडिज्म जहाँ पे हमारा थायराइड ग्लैंड कम काम कर रहा होता है, हमारा TSH लेवल बहुत ज़्यादा होता है, हमारे थायराइड हार्मोन्स T3 T4 कम होते हैं, पेशेंट कंप्लेन ऑफ वेट गेन, ड्राई स्किन, ड्राई आईज, हेयर फॉल and other associated problems of weakness and menstrual irregularities in female. And there is another type hyperthyroidism जहाँ पे हमारा थायराइड ग्लैंड ज़्यादा काम कर रहा होता है, TSH लेवल ज़्यादा कम होते हैं, T3 T4 लेवल ज़्यादा होते हैं, पेशेंट कंप्लेंट ऑफ वेट लॉस, एंग्जाइटी, इट कैन बी हाई ब्लड प्रेशर, रेस्टलेसनेस, फिजिटिनेस एक्सेट्रा. So we advise you homeopathic management for all these complaints, where unlike allopathic medications जहाँ पे हमारा regular increasing doses से हम उसको manage करते हैं to normalize the thyroid hormones, here with homeopathic treatment we fixes the basic metabolic problem जहाँ पे हमारा thyroid normalize हो जाता है. अगर वो कम hormone secrete कर रहा है तो वो ज़्यादा करने लग जाता है और ज़्यादा कर रहा है तो कम. Next our medicines act on your pituitary gland जहाँ पे अगर TSH level pituitary कम secrete कर रहा है तो वो balance होके ज़्यादा और ज़्यादा होके तो कम. And then henceforth our body heals itself because thyroid hormones are normalized by its own by the action of medicines, not directly by the action of medicine but with the help of your immunity system and your metabolic system, which has been fixed by holistic homeopathic medicines. Now we come on to dietary management. So in hypothyroidism जहाँ पे हमारा thyroid कम काम कर रहा है, TSH level ज़्यादा है, the things we should add in diet are antioxidant rich food items, strawberries, blueberries, tomatoes, and capsicums, and there are many fruits and vegetables which are high in antioxidants, so they help. Then food items which are high in multivitamins and especially B vitamins like whole grains, whole cereals. गेहूं को स्प्राउट करके ले सकते हैं आप, पूरा बिना छना आटा ले सकते हैं, and brown rice you can add, parboiled rice. These are rich in B vitamins which will help. And then there is food items rich in selenium like nuts, sunflower seeds, sunflower oil, which is very important for our thyroid hormone production. And tyrosine rich food items. Tyrosine is a amino acid which is essential in production of T3 and T4, which are our thyroid hormones. So which includes meat, milk and milk products like paneer, cheese, etc. Legumes, puri दालें लीजिए, sprouted दालें लीजिए, which will help to increase your thyroid activity. Next we can use herbal medications like ashwagandha, gugol, etc., which will help, and lots of physical activity to boost your system, boost your metabolism, because patient is already gaining weight. Then the things we should avoid soya. I know it is very good, important ingredient. It is a high protein rich food item, but yes, we should avoid soya because it inhibits the action of thyroid gland. Then we should have iodine in moderation, not lots of iodine. We should use combination salts like iodine salt, thoda ले लिया, थोड़ा rock salt, थोड़ा काला नमक, थोड़ा सेंधा नमक, sea salt. We should add the excess of iodine again hampers our thyroid gland. So we should avoid excess of iodine, and we should not solely depend on iodized salt. We should have mixed salts in our diet. Iron and calcium supplements, we do not advise iron and calcium supplements to our patients with hypothyroidism because it decreases the absorption of medicine. आप कोई भी अगर thyroid medications ले रहे हैं तो उसका absorption decrease करता है. Then we avoid taking high fiber food with the medicine. Medicine से 2 घंटा 3 घंटे के gap में आप high fiber food ले सकते हैं, not with the medicine, because it decreases the absorption. Then there are few vegetables which we should avoid like cabbage, broccoli, cauliflower, etc., which hampers the action of thyroid gland, so we should avoid them. And of course we should avoid lots of coffee, caffeine intake, nicotine, tobacco, alcohol, smoking, which decreases the effect of medication also, and they have other side effects also, so we should avoid it. Next we come on to hyperthyroidism जहाँ पे हमारा thyroid gland बहुत ज़्यादा काम कर रहा है. So for that you should have lots and lots of calories. You should have frequent regular meals to combat that weight loss you are having. And then you can have lots of cabbage and broccoli and cauliflower, etc., because they tend to decrease the thyroid action. And then we advise you to stop taking iodine rich food avoid iodized salt, and please avoid seafood because that is also very rich in iodine, and take less of salads and vegetables and take more of proteins, carbohydrates and fat to avoid that weight loss you are having. Again, I advise you to start your homeopathic treatment if you are having thyroid problems, because that will fix your metabolism for good and you won't be dependent on the allopathic medications to cure it. And I wish you now happy and healthy life, and you can consult us online on www.goyalcare.com and on our clinic. And if you have any problem, you can give in your comments. So wish you a healthy and happy life. Take care.